So before I begin, I must commend the previous speakers because they've been excellent at explaining sleep apnea, excellent at explaining the relationship. Dr. Kapoor would have mentioned and quite extensively explained the relationship between sleep apnea and sexual dysfunction and all of that, all of those problems that couples face. And I'm going to kind of mention that as well in terms of diabetes and how that link is there. Dr. Peru, and we're focusing on those women's issues, and it's so important to understand how sleep is important in hormonal control and balance and regulation. And of course, Dr. Hutchinson, who drove the focus towards cardiovascular disease and so eloquently described sleep apnea, how it is treated, what it is, and then of course some of the comorbidities or some of the causes as well of sleep apnea and what we could do to prevent it, what we could do to deal with it. My aim today is pretty short. I'm not going to take a long time, but my presentation hopefully will leave you with an impact that would accomplish a few things. One, at the end, we want to make people more aware of what sleep apnea is. We want to make people more aware of how important sleep is to your health. And two, we want to demonstrate how important it is for us to get some questions answered, do some research, because I'm going to demonstrate where the gaps are in research. Me being a researcher, I'm not a medical doctor, but I'm a researcher at the University of West Indies. So there are many gaps, and this is where we're teaming up with ISD Health Solutions, the Diabetes Association, to answer some of those questions. And as Gregory mentioned, we are going to be talking about some of those projects at the end that we want to launch and put out. So I'm just going to go right into it. And everybody has been talking about sleep apnea, and I know there are physicians here, there are other medical professionals here. There are people here who would have seen sleep apnea, but for many of you all, many of us, you may never see sleep apnea in yourself unless it's recorded, because of course you're sleeping and you may not know about it unless you have some of those symptoms that Dr. Hutchinson would have shown you at the end there. So I'm just going to start with what sleep apnea looks like. So I want you all to just look at this, look at the video. I'm not going to say anything while the video is running. The first time I saw this video, I think my heart stopped as well. And I wanted to just look at the video, look at what happens to someone in the night when sleep apnea hits. And you're going to notice that their breathing stops. And I'm going to challenge you. I'm going to challenge you to hold your breath while the person stops breathing. See if you could do it. While the person stops breathing, you're going to hear when they stop. You're going to hear when they start. Let's see if we could do that together. All right, so let's. All right, so that was again, one of the sleep labs that Dr. Hutchinson would have mentioned, but a recording of what happens to some persons. So we say that sleep apnea is defined as more than 10 seconds of not breathing or about in the night. That was 40 seconds. I mean, that could have happened to any of us. And any of you all holding your breath there, almost none of you may have been able to hold your breath for 40 seconds comfortably. I certainly couldn't have done it. So that's what's happening to you in the night. And as some of the previous speakers mentioned, it may happen multiple times an hour throughout the entire night. And you may be conscious of it because mechanisms may kick in to wake you up. And sometimes you may not be conscious of it. And you may not understand that there's a problem, but there's a huge problem. And there's such a huge problem that, as Dr. Hutchinson showed, a lot of people in Trinidad, we may think, there's an expression we use, although it's I forget what they call it in English, but I mean, it makes no sense. Can't remember right now, but anyway, people in Trinidad say wake up dead, right? So when you basically don't wake up in the morning, and we attribute it to heart attacks, as Dr. Hutchinson explained, a lot of it is due to sleep apnea. So we need to be cognizant of that. We need to understand that, and the relationship, particularly with diabetes. And I'm going to just quickly explain what the relationship between diabetes and sleep apnea is, and then how important diabetes is in terms of the prevalence of diabetes in Trinidad and Tobago. All right, because I'm focusing on here. So I'm going to start with the definition. It's a question. Yeah. So the definition of sleep apnea, and this has been shown many times before by all of the presenters, in terms of it being an abnormal breathing pattern where either you partially stop breathing, right? As mentioned before, hypopnea, or breathing stops completely, and then that's apnea, all right? And then we're talking about obstructive sleep apnea, which was mentioned and described before. So that's what we're going to be talking about. And it was also described by Dr. Kapoor, what is mild, what is moderate, and what is severe sleep apnea. So they made my job very easy in that you all understand those concepts. So I could explain the relationship between diabetes and sleep apnea. So I want to ask you all a question. And this is the question. And I want you all to, where is the chat? I want you all to just post your answers, type your answers in the chat, because I do have the rule feature enabled. Trying to see the chat. Yeah. So just post your answers in the chat. Sorry. Yeah. So post your answers in the chat. What is the prevalence of obstructive sleep disorder in people living with diabetes? Type it in the chat now. All right. Just type it in the chat. Not the Q&A, in the chat. You can type it in the chat. All right. All right. 58%, 86%. All right. All of you, make a guess. Make a guess. B, 58, right? 86, D, C, right? Okay, good. All right. Lots of answers there. What's the prevalence of obstructive sleep disorder in people with diabetes? Well, all of you all are wrong, but all of you all are also correct. And let me explain what I mean by that. There's no easy answer for that. There's no simple answer for that. What is the prevalence of obstructive sleep disorder in patients with diabetes? Because the answers are so variable. Meaning that, as I said, all of them are correct, all of them are incorrect at the same time. There's no simple answer because there are many studies on sleep disorder, and I'm going to tell you about some of them. And I'm going to tell you how variable they are based on population. So you can't just say diabetes and whole diabetes is a general description of people living with diabetes. And I just kind of pulled out 4 of the published statistics on relationship between sleep disorder and obstructive sleep disorder and diabetes. So 8.5% was seen in one study by Brooks, and this was of course moderate obstructive sleep apnea in men, right? 18% was seen in a study in patients with primary care. 58% was seen in older persons with diabetes, and then 86% was seen in persons with or obese populations, persons who are overweight and also living with diabetes. So I'm just representing this to show you that there's no simple answer for saying what is the prevalence. And of course, none of this represents Trinidad and Tobago. None of this represents the Caribbean. So here's where we have questions that we need to get answered. All right, so here's where we have these questions to answer. So generally, it's taken as, in most of these sources, we give an average of about more than 7 in 10 adults with type 2 diabetes may also have obstructive sleep apnea. So if we take that average, and that's an international average that we want to use, then we see it's a huge problem, because in a little while, I'm going to tell you how many people actually have diabetes, or what are the incidence of diabetes in Trinidad and Tobago, and of course around the world. So more than 7 out of 10 people have the condition. Here's where I'm going to explain some more of the gaps. In all of these studies that I've looked at, and in all of these studies that have been performed, the majority of these sleep studies looking at the relationship between diabetes and sleep apnea has been done in either European or Caucasian populations. So there are very few on Afro populations, Afro-Caribbean populations. There are very few on Asian, South Asian, Indian populations. And of course, as we all know, ethnicity and culture has a huge role to play in some medical conditions. So we need to get these answers. So we've been using averages for populations that may not directly be comparable to what we have in Trinidad and Tobago. So here's a question that we need to get answered. The other question, and Dr. Hutchinson mentioned it, and the others mentioned it as well, is diabetes and sleep apnea, the relationship. Now, when we think about relationship, we could think about, well, what comes first? Chicken or the egg? What comes first? Is it the sleep apnea or the diabetes? Does diabetes cause sleep apnea? Does sleep apnea cause diabetes? Or is it the other way around? So we need to understand this condition, this conundrum. And of course, we think it may be vice versa, but there is only strong evidence for one side. So looking at this, I was able to find a meta-analysis that involved over 2,000 articles. So over 2,000 articles were reviewed. And what the conclusions are, based on all of these articles on diabetes and sleep apnea, are that obstructive sleep apnea causes diabetes as much as a 92% increase of risk of diabetes mellitus if you have obstructive sleep apnea. So if you have sleep apnea, that is a cause for diabetes. And of course, previous presenters would have mentioned the relationship between sleep apnea and being overweight. There's also a strong relationship between diabetes and being overweight as well. So we see that there's a strong indication that sleep apnea leads to diabetes. There isn't a very strong indication that diabetes causes sleep apnea, on the other hand. They may be independently related, meaning that they may occur at the same time, and quite often they occur at the same time. But the evidence shows that more often sleep apnea is going to be a cause of diabetes. So here now, we've always been thinking that diabetes, the causes of diabetes were being overweight and not eating properly and not exercising enough and familial predisposition, but we've been ignoring sleep. We've been ignoring how much sleep you get, and we've been ignoring the quality of sleep you get. And we now seen that it is, or we've always known, but again, we've kind of ignored it in public health, I think, in the Caribbean for a very long time. So I'm happy that ISD, the sponsors and the speakers are here to talk to all of you all and raise awareness about the importance of sleep and diabetes care. So it's not just exercise, not just diet, not just medication, not just psychological or stress management, but also sleep. Sleep plays a huge role here in preventing diabetes, right, or limiting diabetes. And also in terms of diabetes control, this is just a study that shows that we see patients with more severe sleep apnea when you have more, well, when their blood sugars are less controlled. So if you all know about HbA1c, the gold standard of measuring diabetes management, we see patients with HbA1cs above 7.5, poorly controlled blood sugars having moderate and severe sleep apnea in more instances than those with well-controlled blood sugars. So what that means is if you have diabetes, chances are that if your diabetes isn't well controlled, sleep apnea as well is going to be more prominent within those populations. So there is that huge link as well. And I am going to mention children, and Dr. Hutchinson did mention children, and we do have sleep apnea occurring in children. So normally sleep apnea will occur in children who are not overweight or normal weight or non-diabetic. Because of some of the conditions she mentioned, it may just be crowding at the back of the throat, and some other congenital conditions that was mentioned before. But for children who are obese, overweight, then in 60% of these children, we do see sleep apnea. And of course, these obese children are the ones who are pre-diabetic and the ones who may become diabetic as well. So there's this relationship again, and it's a huge problem. Seeing if it is that you see a child snoring very loudly as was described, and then they stop breathing in the night. So this again is something that we need to be cognizant about. We need to look at it carefully, not just looking at adults with sleep apnea, but also children. So that's something that we need to push in Trinidad and Tobago. And I'm saying it like that because with my organization in Trinidad and together with ISD, we are going to be pushing this. We are going to raise awareness about this and make some of those changes that need to be made. So effects of sleep apnea, and again, we're not going to go into too much detail because it was already covered by the other presenters before. But I think everything was covered in terms of high blood pressure, snoring and depression and hormone disruption and insulin resistance, which I'm talking about now, cardiac problems and stroke. But of course, death is something that people don't quite associate, or if it is that they do associate it now with sleep apnea, they're going to pay a little bit more attention to it. So again, with sleep apnea, it's like the elephant in the room, and as I said, we've been ignoring it for a long time. We've been ignoring it in public health in Trinidad and Tobago, in the Caribbean for quite a long time, and we need to wake up. We need to wake up to it. We need to wake up to the importance of it. Just one of the studies that I pulled, the one with the obese persons, where 86% of them who had sleep apnea, among them, only 5% of them rather, would have been getting treatment. So of that large proportion of persons with sleep apnea, not a lot of them are actually getting the help that they need. And here's where the problem lies. And here's where we need interventions to not only detect sleep apnea, but then what's the next step? What are some of the treatment mechanisms? What are some of the treatment methods needed to be able to help these persons? So here's where we need this. So again, I'm trying to educate you all, but I'm also trying to convince the population. I'm trying to convince the attendees to help us really make this change with your patients, with your families among Trinidad and Tobago. So raise this awareness that's so needed on World Sleep Day. So I've been talking about sleep apnea and the importance and the relationship between it and diabetes, but I want to bring it back to what diabetes is and how big of a problem diabetes is in the country. Because as I said before, on average, we could say more than 7 in 10 persons with diabetes have sleep apnea or some stage or form of sleep apnea. And around the world, we estimate that there may be about 400 million persons living with diabetes. And we also estimate by the year 2035, that might close to double to 600 million persons. But I mean, that's an international statistic. So what is it in Trinidad? What how does it compare? How is that comparison in Trinidad? What is it? So if I would have looked at the IDF Atlas and pulled out some of the data in terms of general prevalence, right? And this, of course, isn't the most recent. I think I did this a few years ago. Trinidad actually ranks, let's move around this, yeah. Trinidad actually ranks about 19th in the world of all of the countries, 223 countries. Trinidad ranks 19th. But if you notice, all of the other Caribbean islands rank in the top 25, top 30 as well. So the problem is not just unique to us. The problem is it's something that's going on in the Caribbean, where we are scoring top points in diabetes prevalence. All right, so we are some of the smallest countries in the world, but at the same time, we show, or we have some of the highest prevalences of diabetes of all of the countries in the world. So what does the picture look like in Trinidad? So first time diabetes research was done in Trinidad, this would have been, this would have been about 60 years ago when Professor Poon King, anybody who knows diabetes research will know the name Poon King, would have conducted national surveys. And at that time, he was able to find 2% of our population living with diabetes and 2% with impaired glucose tolerance. From the work that I was able to source and what I was able to find, 96, there was another study where we had a self-reported diabetes prevalence rate of about 11%. And then there was a STEP study in 2012, which showed a prevalence rate of about 13%. And on top of that, you had about 20% with impaired glucose tolerance, or what we could say is an indication of prediabetes. So about that time, about 30%, 35% of persons with either diabetes or prediabetes. Since then, of course, research hasn't been done in Trinidad to extensively estimate the proportion of the prevalence of diabetes. And of course, this is almost 10 years later. We need to get this data. The Diabetes Association is about to embark on a national survey to collect this data and really find out what is going on. But from our estimates, looking at the projections, what we could safely say, and the IDF, International Diabetes Federation, supports this, is between 13 to 16% of our population as of 2019 may be living with diabetes. So it's increasing. So that estimate is like 200,000 out of a population of let's say 1.5 million we have in Trinidad and Tobago right now. It's about 200,000 people or more living with diabetes. And on top of that, those with pre-diabetes, 300,000 people. So 200,000 plus 300,000, and 7 out of 10 of them would be within the area of about 350,000 people may have sleep apnea. So 350,000 people living with diabetes or pre-diabetes may have sleep apnea. And of course, that's not counting people who may not have diabetes and also have sleep apnea for other reasons. So I just wanted to show you this statistic because I wanted to show you, although we don't have direct information or direct data of the prevalence of sleep apnea in Trinidad and Tobago, we can make these assumptions based on other pieces of work done around the world. But of course, there's still assumptions. We need to find out how big of a problem this is, because we can't do it by ourselves. The Diabetes Association can't do the work by ourselves. ISD can't do the work by ourselves. We need government intervention. We need private sector intervention. And here's where we need that support from you, or we need that support to be able to help these persons. We need to know how many people actually die from sleep apnea, because I would assume it is quite a high number of persons that die in their sleep, that wake up dead, and it may be due to sleep apnea. So I also mentioned children, and we now know that children are now more susceptible, or actually more children are having type 2 diabetes. Studies done in 2012 and 2013 showed that a much larger proportion of children are now developing adult type diabetes, type 2 diabetes. We have started at the association a child lifestyle camp, teen lifestyle camp rather, where we meet and we treat with these children, teaching them how to do the things that they should do to be able to live healthier and reduce their weights and decrease their chance of developing diabetes. And the association has continued to do that, and we are going to continue to do that this year. although COVID has hit us and our camps have been now virtual, we're hoping that soon we could be able to meet these children to help with this and reverse this. This is just a piece of data that we were able to collect. I think this was in 2014, so it's dated as well, but this was really the last large study where we looked at children. This was with the Trinidad and Tobago Olympic Committee and the Johns Hopkins University. When we looked at the prevalence of children who are overweight and obese. This was a study in South Trinidad, but we involved 3,300 children and we looked at them, and generally we saw that 1 in 3 children, male or female, were either overweight or obese in primary schools. When we compared that data when we define obese children as above the 95th percentile, our data by age group from first year to standard 5 compared to data in the United States that we got from CDC, at every age group from first year to standard 5, we see that our children are bigger. Like a larger proportion of our children are bigger, overweight, more obese than the United States. So again, that follows with the prevalence of diabetes, where Caribbean countries are scoring much higher than the larger countries, even though we have smaller populations. So here again is a wake-up call, because as I said, children who are obese may have a 60% chance of having sleep apnea. So it's a huge problem that we need to tackle, and it's getting worse. And we're just talking about it, but now is the time for action. Time for action was a long time ago, but the sooner we take action, then of course, the more impact we can make, more impactful we could be. And I want to close off by kind of just showing you the importance. Again, we spoke about obesity, and obesity and diabetes goes hand in hand. And I'm not going to go too much into detail with what diabetes is and how the relationship is, or what the relationship is, but we all know that obesity and diabetes goes hand in hand. And it's a problem that's growing. And one of the issues is that, just like with sleep apnea, people don't talk about it as much, or people don't, they're not aware of it. Obesity is also becoming like that, and people are growing in weight, and it's becoming normalized, because if everyone looks like you, then nobody is different, then there's not a problem. But I mean, I wanted to illustrate this by showing this image, because 100 years ago, so this was the largest man in the world, the biggest man in the world, so Big Joe. And if you walk down the street, everybody would turn and look at him, because there was no one else looking like him, right, back then. But of course, now there are people like that all around, and it's become normalized. And these are the people who have these issues, and they don't seek treatment for it unless they can no longer function, they can no longer work. They are at the point where they're so sick that they can't provide for their families. And here's where we need the interventions. Earlier interventions mean more impactful interventions. And of course, the problem isn't just limited to the United States, so it's around in Trinidad as well. So with that, I want to just close off by saying that, again, I want to reiterate that this is why we want to do this program with ISD. We need to assess persons with diabetes, assess the impact of sleep apnea, assess that in Trinidad. We need to get those questions answered. And we are going to be doing that work. And Gregory is going to talk a little bit more about the initiative that we've launched with Massey Stores, and what we are going to be doing with the Diabetes Association, collecting that data, presenting the importance of sleep, and looking at sleep apnea. So we're going to be doing that as the association. And then to close off quickly, I have to plug in the association and the work that we do, because I want you all to reach out to us. We are an NGO. We are run by volunteers. We are based in Chaguanas in Trinidad. Currently we're about 30 years old. We have about 5,000 members. Although we don't have much paid employees, all of us, I am as well a volunteer at the association. And our main aims of the association are advocacy, education, and research. So education, because of course, education is the key to diabetes prevention, diabetes care. Advocacy, because we are the organization that is speaking up for persons living with diabetes, speaking up for persons affected by conditions that may cause or that may that may cause issues for persons living with diabetes. And of course, research, a huge component that I am now pushing, because I'm recently the president a couple of years now, pushing research, because of course we need that research. And again, that's the theme of my presentation today, the importance of that research. The
Thank you,
association,
Andrew.
yeah.
Thank you
Great.
so much, Andrew. I really appreciate what you've done today for us and the understanding of diabetes and also the understanding that we need more information.